Sitting. The ability to sit follows progressive head control and straightening of the back. Locomotion, movement. By 6 to 7 months old, they're able to bear all of their weight on their legs with assistance, holding on to something, not by themselves. Crawling, that's when they propel themselves forward on the belly. That progresses to creeping on the hands and knees, that's with the belly off the floor, by 9 months old. At this time, they stand while holding onto furniture and they can pull themselves to a standing position, but they're unable to maneuver back down except by falling. By 11 months old, they walk while holding onto furniture. That's called what? Cruising, yes. They walk while holding onto furniture or with both hands held. And then by 1 year of age, they may be able to walk with one hand held. Look at this nursing alert. An infant who does not pull to a standing position by 11 to 12 months, they should be referred for evaluation of possible dysplasia of the hip. That might be why they can't bear that weight, because by 11 to 12 months, they should be able to do that. Okay, let's move on to psychosocial development, developing a sense of trust. Remember, when you're thinking about trust versus mistrust, it's all about Erikson. That is the theory, right? Okay, so Erikson's phase 1, that's birth to 1 year old. We talked about this last week. This is concerned with acquiring a sense of trust while overcoming the sense of mistrust. A trust that develops is the trust of self, of others, and of the world. Infants trust that their feeding, comfort, stimulation, and caring needs will be met. They trust that if they cry, they'll be changed appropriately, they'll be fed, they'll be played with. The provision of food, warmth, shelter by itself is inadequate for the development of a strong sense of self. They have to be comforted, they have to be loved, they have to be played with. You can't just provide the physiological needs. Failure to learn delayed gratification leads to mistrust. Mistrust can result from either too much or too little frustration. So if the parents always meet the children's needs before the children can signal their readiness, they'll never learn how to test their ability to control the environment. You're always ready to give them a bottle, change their diaper, do everything before they even cry. How are they even able to test their environment, right? So you don't want to do it too early, but you don't want to do it too late either. Because if it's delayed, if the delay is prolonged, then the infant will experience constant frustration and eventually mistrust others in their efforts to satisfy them. Therefore, look at what the key is: consistency. Be consistent. Consistency is the key. You have to have a balance. That's why I wrote here, must be a balance. Okay, so now we're going to switch gears. We're going to go from developing a sense of trust, which the theorist was Erikson, and we're going to sensory motor. We're going to go to cognitive development. Remember cognitive development, cognition, how you think. When you're thinking of cognitive development, you need to be thinking of Piaget. That's the theorist for thinking. The period from birth to 24 months, that's what's known as the sensory motor phase. Birth to 24 months, that's a sensory motor phase when we're talking about cognitive development. During the sensory motor phase, remember birth to 24 months, the infant progresses from reflexive behaviors, things that they do automatically, to simple repetitive acts to imitate activity. So they go from an automatic smile, they're not smiling on purpose, it's just reflex, to smiling because they're happy and they see you smiling. 3 crucial events take place during the sensory motor phase. You need to know those 3 events. 1, the first event. This involves separation, in which the infants learn to separate themselves from other objects in the environment. The second major accomplishment in the sensorimotor phase, this is a concept of object permanence. We heard a lot about object permanence. This is the realization that objects that leave the visual field still exist. And the third, the last major intellectual achievement. Let's stop for a second because I just want to bring something to your attention. Look how the author put that word in there, intellectual achievement. That's their way of reminding you that we're talking about what? Cognition, how they think, okay? The last major intellectual achievement of this period is the ability to use symbols or mental representation, such as a bottle meaning food. I know, it's a lot. Don't shoot the messenger. I know, it's a lot. Development of body image. Achieving the concept of object permanence is basic to the development of self-image. By the end of the first year, infants recognize that they are distinct from their parents. They're separate from their parents, separate entities. At the same time, they have increasing interest in their image, especially the mirror. I put a star next to it, I put NCLEX next to it. NCLEX expects you to know that. Did I tell you guys? I'm going to be teaching. I'm going to be doing NCLEX review for the NGN. Not for you guys. Interest. No, not for you guys. Thank you. I made the announcement like 2 weeks ago, and all of my classes are already booked. So I'm excited about that. No, it's a conflict of interest, but you guys are in good hands. I'm not going to say the name of the instructor, but you know who she is. You guys are in good hands. She knows her stuff. She's going to prepare you. Don't look at me like that. I promise you. I'll talk to you. Talk to you after the report. But you guys are in good hands. She's good. She knows her stuff. You guys will be fine. Stop it. You know why she even said anything. Okay. I promise you guys. I promise. She knows her stuff. You guys are in good hands. All right. Social development. Everyone there? Yeah. All right. Play. Play is a major socializing agent and provides stimulation needed to learn from and interact with the environment. The work of the child is play. That's how they learn about themselves and the environment. Just like the work of the adolescent is socialization, right? So play is a major socializing agent. By 6 months old, infants are very personable. They play games such as peekaboo. When their heads are hidden in a towel, they signal their desire to be picked up by extending their arms, and they show displeasure when the toy is removed or their faces are washed. They hate getting their faces washed. When infants are not provided a safe haven and, look at this key word, consistent and loving care, and insecure attachment develops. Such infants do not feel they can trust the world in which they live. This insecure attachment may result in psychosocial difficulties as the child grows and may persist even into adulthood. Insecure attachment may also exist in homes where there's domestic violence and maternal postnatal depression, because think about it, if mom's depressed, she's really not caring for the child as she should. Something they didn't mention that we can also add to this list, besides the domestic violence and the maternal depression, also when there's drug use by the primary caregiver, and there's addiction going on. Attachment progresses during infancy, with the infant assuming an increasingly significant role in the family. Two components of cognitive development are required for attachment. One, the ability to discriminate mother from other individuals, right? And that really helps mom to be attached to the infant and vice versa. And two, the achievement of, again, there goes that phrase again, object permanence. For the first few weeks of life, infants respond indiscriminately to anyone. Whoever will meet their needs, that's what they're going to respond to, right? But beginning around 8 to 12 weeks old, they cry, smile, and vocalize more to the mother than to anyone else, but they continue to respond to others, whether they're family or not, but they'll respond more to mommy. At around 6 months old, infants show a distinct preference for the mother. If both mom and dad put their arms out, they're gonna lean to mom. They follow her more, cry when she leaves, enjoy playing with her more, and feel most secure in her arms. About 1 month after showing attachment to the mother, many infants begin attaching to other members of the family, most often the father, but usually it's always mommy first. So infants acquire other developmental behaviors that influence the attachment process, and these include, and look at this list, differential crying, smiling, vocalization. Visual motor orientation, crying when the mom leaves the room. Approaching through locomotion, so even if they're crawling, but as soon as they learn how to crawl, who are they going to crawl towards? Mom. Clinging, exploring away from the mother while using her as a secure base. So mom goes somewhere in public with the infant, and the infant's they're interested, they're curious about strangers. So they'll hold on to mom while they kind of lean over mom's shoulder to look to see what's going on. But they make sure that they're still holding on to mom because mom is that security blanket for them. There are two different patterns of attachment disorders. Emotionally withdrawn pattern and indiscriminate disinhibited pattern. So with the emotionally withdrawn pattern, this is where the child that should be attached to one or both parents is completely withdrawn, right? Then you have the opposite, which is the discriminate disinhibited. That's the one where they're too friendly with everybody. So let's say you're a nurse working in an outpatient center, and this is the first time you've met this pediatric patient, and they're trying to hug you, they're trying to sit on your lap, they're overly affectionate or friendly. You better suspect abuse. Whether it's sexual or maybe they're just being abused, where they're being, what's the word I'm looking for when you kind of ignore the kid? Neglect, thank you. They're being neglected. So they're trying to find that affection from any avenue, okay? Because in a strange environment, they should be clinging to their parents. Their parents should be their security. They should be scared of you. Infants at risk for severe attachment disorders include, let's look at this. Those who have been victims of physical or sexual abuse or neglect. Infants exposed to parental addictions such as alcoholism, mental illness, substance abuse, and infants who have experienced the absence of a, what's this word? Absence of a consistent primary caregiver as a result of foster care, institutionalization, parental abandonment, or parental incarceration. All of those can cause severe detachment disorder. Children with RAD, I don't know what that R is, but reactive, oh, thank you. Reactive, that's what the A stands for?
Yeah,
Where is it?
attachment disorder.
Oh, thank you, I see it, reactive attachment disorder. So the reactive attachment disorder, what they're talking about is the severe severe attachment disorder, okay? So patients with RAD, they may manifest behaviors such as not being cuddly with the parents. That's that withdrawn behavior, right? Failing to speak and respond to comfort when distressed. Minimal social and emotional, can't pronounce that word, reciprocity. So the parents are trying to show them affection and they're not showing it back. And emotional deregulation such as unexplained fearfulness or irritability. Children with DSED, that social engagement disorder, may exhibit behaviors such as inappropriate approach to unfamiliar adults, lack of suspicion of strangers, and poor impulse control. You're a stranger, they should be afraid of you. Without early intervention, some of these children fail to develop a conscience and develop antisocial personality disorder that may lead to criminal acts. I put a star next to it, and NCLEX expects you to know that. Let me talk to you guys for a second about antisocial disorder or antisocial personality. We tend to use that term wrong. Let me tell you what antisocial personality, that is not the person, when we think of antisocial, we think of a person who does not like to be in social settings, they don't like to be around people. That's not what antisocial personality is. The person who has an antisocial personality disorder, they love being in social settings. Why? They are the biggest con artists on earth. They're good at reading people. They're good at manipulating people. They're like social chameleons. They will turn into whoever you want them to be so they can rob you of their money or whatever it is that they want from you. Okay, they are very manipulative. So people with antisocial personalities, that is the kind of personality that they have. And you need to know that because in psych, you're going to get a trick question about antisocial personality. Do not choose the answer where they don't like being around people, because that is not the antisocial personality. They love being around people because that's the only way they can manipulate you. Okay. Let's talk about separation anxiety. So separation anxiety up here, I wrote between 4 to 8 months. That's when you should start seeing that in the child, but they should definitely have separation anxiety by 8 months. You should see this in a child. Between 4 to 8 years of age, infants progress through the first stage of separation, individualization. They start to realize that they are separate from that primary caregiver. There goes that phrase again, object permanence. Object permanence is developing, and infants are aware that their parents can be absent. By 11 to 12 months of age, they're able to anticipate mom's immediate departure by watching her behaviors. They can see cues such as her putting on her shoes or grabbing her purse, right? And they begin to protest before she even leaves. The minute they see her putting on her shoes, they're crying because they know what that means. At this point, many parents learn to postpone alerting the child to their departure until just before leaving. So what the parents will do, they'll put their shoes right next to the door. So they won't have to put on the shoes until they're right about to leave the door. Or they'll have the purse or their keys right next to the door so that they can postpone that signaling to the child. Next, stranger fear. And up here, what did I write? I wrote examples. See mom, grab purse or keys, put on shoes. Okay, that was for the separation anxiety that I was talking about. Now, stranger fear. Between 6 and 8 months old, fear of strangers and stranger anxiety becomes prominent. This is where you see it the most. It becomes prominent between 6 and 8 months and is related to the infant's ability to discriminate between familiar and unfamiliar people. So of course, before around 6 to 8 months, they're not able to discriminate between, strangers and non-strangers. So they won't have that anxiety before then. But as they start to tell the difference, that's when that anxiety increases. Language development. Infants' first means of verbal communication is what? Crying. They can't talk it, so they cry to tell you when something is wrong. Crying tends to decrease by 12 weeks old. At the end of the first year, infants cry for attention, from fear, if they're afraid of something, and from frustration, usually in response to their developing but inadequate motor skills. Them trying to put one block and it's not working. They keep failing. By 9 to 10 months old, they comprehend the meaning of the word no and obey simple commands. By 1 year old, they can say 3 to 5 words with meaning and may understand as many as 100 words. It's important that infants are exposed to expressive speech and that infants with delays in achieving milestones are carefully evaluated for potential hearing loss. So that's important. You need to know those milestones when they'll start saying words such as mama, dada, or even one word or two word syllables. Because if you're not seeing that, they need to be referred, because usually what happens is they'll have a hearing problem. We just didn't know about it. Because at first, when they start saying words, why are they saying those words? They're just repeating what they hear. So if they can't hear, they're not going to repeat those words.